It's a matter of life and death. Since midday, 20 governors were holed up in a crisis meeting, hoping to reach a solution that would end the widespread suffering occasioned by the health workers' strike.
There has been progress in negotiations between the two levels of government and the nurses. And tremendous progress has been made, and we think the strike with the nurses may be resolved very soon.
The doctors, however, have not returned to the negotiating table, even as the governors scratch their heads over how to meet their demands.
You will agree with me, 300% increase on salaries of doctors that would put a trainee doctor who has just joined at 400,000 is not realistic, unless county government stop doing anything else and channel all resources to paying salaries.
Money, they reckon, is at the center of the crisis.
Why should the national government continue keeping 50% of the budget of health when it is running only 10% of the health sector? Yeah. That is, I mean, in fact, I would say that is the cause of this problem.
Section 174 and the fourth schedule of the Constitution places all public health facilities, with the exception of Kenyatta and Moi Teaching and Referral Hospitals, as well as Mathare Hospital, under county governments. That vests the responsibility of managing majority of striking doctors and nurses under the county governments. But the constant friction between the health workers and the county governments has raised questions on whether devolving the health function was the right thing to do.
It's not counties that are unable to handle health. The fact that there is labor unrest is not an indicator counties are unable to handle health, because health is not about labor only. Labor is just one of the issues.
Although the Health Ministry has been central in trying to unlock the stalemate, it stands accused of reneging on the implementation of the contentious collective bargaining agreement.
If health was already devolved, on what basis were you signing a CBA with the union without involving the new employer?
Perhaps as the night goes on, as we continue to discuss using all means, and secondly, as the dawn comes, we will be able to meet and be able to work a formula whereby the two parties can find their way back to work.
Amidst the nationwide crisis, however, two counties remain a haven for patients, Nakuru and Bomet. How come, we ask?
Burdens of counties are also different. Yeah. Some counties are carrying bigger burdens. Others are smaller burdens, depending on the history and the size and all those things. Some are running level 5 hospitals, over 100 doctors.
The collective anxiety of the nation is palpable. It had been hoped that a deal would come through by end of today. But it seems the wait continues as leaders tread accusations over who holds the key to unlocking the stalemate. Sylvia Chebet, Citizen TV, Nairobi.